history of HIV and AIDS epidemic in the Black LGBTQ plus community, then and now. My name is Cameron Cunningham, and I'm one of the training and technical assistance managers at the African American Behavioral Health Center of Excellence. Today's webinar is sponsored by the African American Behavioral Health Center of Excellence, which is a 5-year federally funded project by SAMHSA, the Substance Abuse and Mental Health Service Administration. We're funded to transform behavioral health services and systems for African Americans. If you would like to gain more information about the Center of Excellence, it can be found at www.africanamericanbehaviorhealth.org. And just a few points of housekeeping, and then we'll definitely turn the remainder of our time over to our facilitator today. But as a part of our commitment to SAMHSA, we are required to evaluate every one of our trainings and every one of our webinars. So today we kindly ask that you complete the GIPR evaluation form. You'll see that coming through the chat periodically throughout the webinar, and towards the end of the webinar will be posted as well. But again, this is a requirement of our funder agency. So we ask that you would continue to assist us and continue to evaluate our webinars. This allows us to continue to provide these learning opportunities. So we thank you again for your participation there. If you today would like to receive a certificate of participation by your very being here at this webinar, you can request that today by sending an email to plee@msm.edu. Again, that is PLEE@msm.edu. All right. Well, without further ado, I want to take some time and introduce our speaker. Our speaker is none other than Dr. Lawrence Bryant. Dr. Bryant brings a plethora of experience and knowledge dealing with substance use disorders, HIV and AIDS prevention and education, DEI training, and education on LGBTQ plus issues. Dr. Bryant, he has successfully facilitated and helped implement a statewide strategic plan for Georgia in response to the opioid and prescription drug overdose epidemic. As a result of this formative work, Dr. Bryant has received a grant from GDPH to do multicultural needs assessment among vulnerable populations in support of the statewide strategic plan. Dr. Bryant has published over 20 peer-reviewed articles in the area of HIV and AIDS, homophobia, racism, and tobacco use prevention. And Dr. Bryant has been a registered respiratory therapist for over 45 years, fighting on the front lines during the COVID-19 pandemic. As a part-time assistant professor at Kennesaw State University and Capella University, Dr. Bryant teaches courses on and in substance use disorders, health and wellness, and completes thus research and training in the areas of substance use disorder prevention, treatment, and recovery. Dr. Bryant is the founder and CEO of Passion and Purpose Consulting, providing training and educational information on behavioral health, HIV, DEI, and substance use issues. So without further ado, if you have any questions throughout this webinar, please feel free to post it in the chat. Pilar and myself will be monitoring our chat today, but without further ado, I want to turn the remainder of our time over to Dr. Bryant to facilitate this webinar, The History of HIV and AIDS Epidemic in the Black LGBTQ plus community then and now. Dr. Bryant?
So I want to welcome everyone, but always I want to just acknowledge and show respect for the African American Behavioral Health Center of Excellence at Morehouse School of Medicine, who just does such phenomenal work in this area and really allowed me the platform to be able to present what I consider probably one of the dearest topics in terms of my research as well as my work. And this absolutely gives me an opportunity to not only share with you professionally, but also personally in terms of my experience. So today, the history of HIV/AIDS in the Black LGBT plus community, then and now. And so I want to make sure, as we really look at our objectives, I want this to be conversational. I want this to be interactive. At one point, I'd like to even ask some of those that have experience historically in HIV and AIDS, and perhaps briefly share some of those experience of what you've been through, but even more importantly, what you are doing now in terms of impacting the epidemic in our community. So number one, we want to discuss facts around the history of HIV/AIDS, of course, in the Black LGBTQ plus community. We'll engage in conversation. The chat will be a place that you'll be able to share ideas, and Corey and the rest of our folks at Morehouse will monitor the chat as well. But we really want to get a sense of some others' lived experience historically around HIV and AIDS. Also, we'll talk about the role of social spaces in providing support, in providing resources, and providing a safe space for us to be able to really historically deal and cope with the epidemic. We'll talk a little bit about the role of race and homophobia, particularly in the Black LGBT plus community. And finally, we'll look at some action steps and look at what others are doing, both here in Atlanta and other places, to help address the epidemic as it is still raging in our community. So buckle up your seatbelts. And I'd like you to just, if we could also make sure that everybody's on mute. On this next slide, I really want for a moment you to just reflect on what I'm about to share with you. And if you would, just close your eyes for a moment. Just close wherever you are, unless you're driving, of course. But close your eyes for a moment and just sort of reflect on what I'm getting ready to share with you in terms of data around HIV and AIDS. And this is data from 2022. So in 2022, over 38,000 people received a diagnosis of HIV in this country. Men are heavily affected, accounting for 79% of diagnosis in 2022. And here it is. Gay, bisexual, and other men who have sex with men are at the epicenter of the disease still. And people aged 13 to 34 accounted for more than one half, that's 56% of HIV diagnosis in 2022. And this is CDC data. And here's what's also very compelling. The South accounted for more than half, that's 52% of HIV diagnosis in 2022. And even more, AIDS VU also pretty much shared some compelling data around HIV and Black women. Black women are disproportionately impacted by HIV, and they account for 54% of new infections in the US. I want to say that again. Black women are disproportionately impacted by HIV, accounting for 54% of new infections in the US. Trans women, African-American trans women, account for 62% of infections among all trans women. In Georgia, African Americans make up 32% of the population, but 71% of the 2.5 or the 2,500 newly diagnosed cases in 2019. And so we've got a problem. We still have a problem. But let's just look at how we got there. Let's look at some historical kinds of things that have been happening. And of course, I am 70, actually next month I'll be 71. So I've been around since the very beginning of the epidemic. But I want to take you back to 2000, to the AIDS conference in Durham, South Carolina. And what Nelson Mandela said, this is just so compelling. He said that we are dealing with the greatest health crisis in human history. He said the numbers that I just mentioned and previous numbers are staggering. In fact, he says it's incomprehensible. He goes on to say, by all accounts, we are dealing with the greatest health crisis in human history. Again, this is in 2000. And this is Nelson Mandela at the International Conference in Durham, South Africa. And so again, I think he really, really captured the essence of what we went through um, around 2000, but also before that. So let's look at this slide here. This is Cedars-Sinai Medical Center. So I'm from Philadelphia originally. And in 1979, wanted to change just in terms of my environment and just wanted to just relocate from Philadelphia. So I moved to Los Angeles, California in 1979. And as a respiratory therapist, a young respiratory therapist back then, I worked at Cedars-Sinai Medical Center, which is in West Hollywood. And West Hollywood, as we know, is probably one of the first gay cities in the United States. But let me just take you back to what it was like and what we were feeling back in 1980. And so, as a respiratory therapist, of course, we deal with patients that have lung diseases and heart diseases. And we begin to see these white gay men come into our respiratory intensive care unit. And they came in with this pneumonia. It was called pneumocystis carinii, which is a pneumonia that's not typical for young men. So we begin to say to ourselves, something is going on. We didn't know what it was. But the thing that was just most compelling is that many of these men had not only pneumonia, but other opportunistic infections, but they went on our ventilators in the respiratory intensive care unit, and many of them died in our respiratory intensive care unit. And so even before it hit the news, even before people were talking about HIV/AIDS, we at the hospital in West Hollywood continued to just see this plethora of young men coming to our unit, and they were dying. And so between 1980 and 1981, in Los Angeles and in our hospital, the medical community was turned upside down. We didn't know what this was. We didn't know how it was spread. Initially, we thought it was airborne. And so many people in our department refused to work in the respiratory intensive care unit. Many people, both respiratory therapists, nurses, and doctors, left the field because we just did not know what was going on, and people were dying in droves back in 1981. And so let's move up to 1981. And what was most compelling is the researchers and medical profession begin to notice that this group were white gay men. And so in reporting these pneumonias, they firstly identified this particular disease as gay-related immune deficiency, GRID, they called it. And that's significant because that identified a group that allowed people to blame someone for what was going on. And so back then, the discrimination, just the fear around what was going on and why so many people were dying back in 1981. And so in addition to the pneumonia, there also was another disease that many of these men exhibited called Kaposi sarcoma. And as you can see in these pictures, this was, I don't know if anybody's seen the movie Philadelphia, but these were sort of like these black blotches that were just all over the skin. And it really, really illuminated just a person that had the disease, because many of these young gay men, white gay men at the time, and there were black gay men as well, but the focus at this time was white gay men. But these black blotches really was a telltale sign early on in terms of the disease. So you had this pneumonia, that these individuals came in with, and we also had this this cancer or Kaposi sarcoma. So as we move forward, just looking at the response, the early response. So this was not just in the hospital, but this also was the response for society as well. And so many individuals lost the support of their families, because often many families did not know that their son, or their child was gay. And so a lot of them, when individuals came down with HIV, had the loss of their family support. Many of them were thrown out of their homes. And so really this fear was just pervasive. Also discrimination around housing, discrimination on the job, those kinds of things. And again, identifying that that group, that gay-related immunodeficiency, gay-related gay disease, really set the stage for much of this stigma and much of this discrimination. And again, not only was it from society, but also from our religious institutions as well. So quite naturally, back in 1980, 1981, this really was a disease that literally just tore our community apart. And so one of the things that when individuals, particularly in the African American community, when we're faced with trauma, when we're faced with disease, when we're faced with something that we don't know or that we're unsure about, we turn or we lean on our faith. And one of the episodes of Pose, which is, I think, one of the best series with many of our LGBTQ persons, really exemplified what was going on back then, and particularly what African American gay men faced in terms of their family and the loss of family support. So I want to just share this video with you, and you can put comments in the chart afterwards. But I really want to I want you to get a sense of like what we were going through back then, and leaning on our families, depending on our families, and not always, but oftentimes we were turned away.
Frying up real nice.
Oh, sure is.
It is. Is this real silk?
Yes, of course. You think I wear rayon?
Should I pull out your high school yearbook? You weren't always a swan.
How much a silk shirt like that run you? $100? $200?
How gauche.
You can call me all the names you want, but the money you spend on clothes, you could fix the leak in that church roof.
Oh, stop it now. It's enough chitter chatter. My baby is home. You have to tell us about your life in New York.
It's good. It's fine. Challenging. That's why I'm visiting.
Most I can lend you is $50.
Oh, hush up now. Baby, is that why you came home? That you need money?
No, Mommy.
Okay.
I came to share something with you.
Well, it can't be worse than the last time you gathered us for a meal.
You mean that time I bared my soul to the women I love and bravely told them I was gay?
Oh, Lord, here we go again. If I have to hear about your sexuality one more time, I do not talk about my sex life.
That's because you ain't got no sex life to talk about.
I'm not here to talk about my sexuality. I'm here to talk about my health.
Is it the sugars?
No, I don't have diabetes.
Well, what is it? Sickle cell asthma?
No, I don't know any other way to say this. So, I have AIDS. I'm dying. I have been HIV positive for 6 years, and I didn't want to burden y'all until it became serious. I know that we've already been through so much, Mommy. I'm not trying to upset you, and I'm so sorry. I'm sorry. I'm really sorry. Mommy.
Pray, let her go, baby.
See, I always knew this would happen. Heavenly Father, save
Stop
his
it.
soul from eternal damnation.
Please stop. I don't need your prayers. I need your love.
I never stop loving you. Hate the sin, love the sinner.
Oh,
Which is why I care about your soul.
Just shut your old big mouth. If you cared about the state of anyone's soul, then you would have stood up for me when the church judged me for getting a divorce.
You had a child out of wedlock with a married man.
I lost my community, all because of some outdated law that was created by men some 3,000 years ago.
No, God's word is immutable. Divorce, homosexuality, pedophilia.
No, don't put those words beside each other. Your God made me this way, and there is nothing wrong with me.
God made you in his image. Everything else is a choice.
You think it was a choice for me to be called faggot and beat every day of my childhood? You think it was a choice for me to lose every man I've ever loved? Sometimes I think I wouldn't even have this disease if it wasn't for the church and how y'all treated me. That's where the trouble started. The drinking and the drugging and the one-night stands.
I'm so sorry. Pray, I didn't know. I know that I can't undo what's already been done, but I need you to know I've always loved you, Pray. And I promise you, I will be there with you until the end.
So, wanted to just reflect on that for a moment as we think about our family, as we think about what particularly LGBTQ persons have gone through, just in terms of homophobia within our own community. And of course, we depend on our community and our family probably more than just about any other group in this country. And to really have our families turn on us and some of it again was out of fear. Others, out of just pure disdain for our sexual orientation. But any comments in the chat? Any comments in the chat before we move forward?
There are a few comments. Mom Rose stated, always have me in tears watching that scene. Stephanie said, powerful. And Quentin said, thank you so much for showing that. Pose is an incredible historical drama. I highly recommend it for anybody who wants to learn more about our history.
I absolutely concur. This Pose, I'm not really sure where it's being shown now, whether it's on Netflix or where, but it just was one of the most compelling series that really reflected our experience through the HIV/AIDS epidemic, but even more importantly, the role that the BAL community played. And we'll talk about this a little bit as we talk about spaces that were integral to really providing support to the LGBTQ plus community when other communities turned their backs on us, when other communities were receiving dollars and were receiving resources, but much of that did not reach our communities back then. And I just want to say, this probably is, it's a slide that's emotional for me because we've got two individuals here, two activists, Yvette Flunder on the right, and Archbishop Carl Bean on the left. So early on in 1981, I met Archbishop Carl Bean. in LA. And I was, during that time, 1981, 1982, I was going through my own dark period around substances. And I really got caught up out there in LA. And in my darkest moment, Archbishop came to me and he held my hand and he said to me, Larry, and he looked me straight in the face. And he said, Larry, you're better than this. You don't have to die from substance use. And he called it drugs at the time. And this was in his church. And so back in 1981, Bishop Bean started what would be a movement that spread across the entire country. Again, many of our churches in the Black community did not embrace us. And so much of what we were taught, in terms of sexual orientation, HIV, really was very negative. Oftentimes it was referred to as an abomination. And so we needed something. We needed someone to tell us that we were okay just as we are. And even at this point, the federal government, Ronald Reagan was the president at the time, didn't even mention HIV/AIDS. And we had, particularly, this is really salient, and this is Pat Buchanan, he's a minister, but he also was a senior advisor to both Richard Nixon and Ronald Reagan. But this is what he had to say about our community. He says, he used the term homosexual, we don't use that term now, but he used the term homosexual. He said, homosexuals have declared war upon nature, and now nature is exacting an awful retribution. This is an advisor to two presidents, but this was the sentiment that was going on in many of our communities back then. But back to Archbishop. And so he initially was a disco singer, and he had a big hit with Motown Records. He was with Motown Records, and this record that he had was called I Was Born This Way. And that record was so popular back during that time that even singers of today, like Lady Gaga, actually recorded that record as well. But Bishop Bean took his influences, took his musical friends and people that he knew from Motown and other areas, and started this advocacy. He started a movement. And the first, in 1982, was called the Unity Fellowship Church. And I was a part of that. I was part of the very beginning. And I'm telling you, it was just something that was so transformative to me, because nobody ever told me, nobody ever said that you were okay just as you are, that God loves you just as you are. That just was not heard of. But in that day that he took me, and we were in church after church, and he told me what he told me, it transformed my life. It changed my life. Now, while I didn't sort of get it right then, it was several years later that the light finally went off on my head. And August the 16th of 2023, we all celebrated 32 years, partly because of him, 32 years in long-term recovery. And so with this Unity Fellowship movement, it really was a place that we could go to and get advice, that we could go to and get resources. It really was a place that we felt safe. And an Archbishop was the one that really helped to facilitate that. And also, he started the Minority AIDS Project, which this was in 1985, which was just phenomenal. It really was a Black-owned organization, and that's important. Black-owned organization that really, and he was the founder, really provided resources and provided housing for minority, LGBTQ plus, and he really, in my estimation, is one of our greatest heroes. And we're talking about Pride Month now. So we got to talk about our own heroes and the role that they played in helping us support one another in the epidemic. So I will ever be indebted to Archbishop. He passed in 2021. And also Yvette Flounder, just a phenomenal person who's the senior pastor at the City of Refuge United Church. Um, and she was ordained by none other than Walter Hawkins. And she founded the Fellowship of Affirming Churches. And she was the presiding bishop, but she just did so much more, just in terms of providing housing. These organizations provided housing, direct services, education, um, and not only just in this country, but also overseas in Africa as well. So these are two of our pioneers. These are two persons that in Pride Month, we really need to uplift these individuals. And there are many more. I'm just identifying these two, many more. And I have to give a shout out, particularly to Black women, because many of our Black, particularly our lesbian persons in our community, were not necessarily impacted as much from the epidemic, but they came to our rescue. They provided themselves as well as resources and comfort to us during this particular time. And so now I want to move towards these spaces that we talked about and how important, because one of the things that was happening is that many of the white communities that were receiving funding from the federal government, much of that was not disseminated into the Black LGBT community. So we had to find our own spaces. We had to provide our own support. And Jules Catch One, and one of the other things in my my former life, I also was a bartender. So I bartended at many bars, many gay bars in LA. And one of the places was Jules Catch One. And I tell you, Jules Catch One, and she is also another hero, one of our formative leaders. Catch One was a place that catered to those persons that were on the fringes of society. She provided a space that we could come to, that we could feel safe, that we could dance, and I'm telling you that we could just have fun. But during a time when there was so much pressure, so much stress, this space provided a way that we could come together, a way that we could communicate with one another, because at this time, there was no Black press. There was a white gay press, but there was no Black gay press. So the only way that we had to really communicate with each other were at these spaces. We could communicate on who needed what in terms of resources, on who passed and who needed support. And during this time, 1981, 1982, actually up to 1988 is when I left LA, we were going to funerals, sometimes 2 and 3 a day. Just imagine that. But we supported one another. And oftentimes it was these spaces, number one, that provided funeral service when many of our churches would not funeralize us, would not embrace us. And so all we had was each other. But these spaces provided a phenomenal place for us to come together and feel safe and share our experiences. And Jewel Catch One was one of the first Black gay clubs that was literally owned by a Black individual. But it was even more. Many stars came to party with us at Jules Catch One. It wouldn't be uncommon to see people like the Pointer Sisters in there. People like even Madonna and some of those other individuals that really came and provided some support. And I must say, we also have to give a shout out and acknowledge many of our entertainers who also came to our aid, particularly Dionne Warwick, other persons, Cheryl Lee Ralph, just heroes in our community, entertainers that lent their money and lent their talent for our community. Elizabeth Taylor was absolutely instrumental. Ryan White, these individuals really helped to provide resources for our community. But again, not only did the Catch One provide a dance space and resources, it also provided Jewel is the owner of the Catch One. And you know, she again is a hero in our community, but also provided education on healing, on healthy living. Uh, Also, one of the places that we could go, 12-step meetings were held also at the Catch One. And again, along with Carl Bean, Bishop Carl Bean, she also co-founded the Minority AIDS Project as well as the Imani Food Project. So Jules Catch One, again, just a phenomenal space. I was so glad to be a part of this historically. And there, if you have not seen it yet, you must see. There's a documentary on the Jewel Catch One and the role that she played in the HIV/AIDS epidemic and the role that the Catch One played in providing safe space. And I believe that the documentary, if I'm not mistaken, maybe on Netflix or it may be on YouTube. But again, it's a phenomenal documentary. I just would implore you to see it. But it really provides a deeper look at and I'm just really, you know, sort of skirting the surface, but just the many services that the Catch One and Jewel actually provided for our community when we really, really needed them. And so I want to talk a little bit about another out of New York. New York is one of the places that was hit hardest. And hopefully I have my colleague, Craig Washington. Hopefully you're on the call. Craig, are you on the call?
Yes, I am, Larry. Excited to be here.
Phenomenal. So let me tell you a little bit about my friend, my colleague, the one that I just a good friend. I've known Mr. Washington probably 30 years, but he just has been so phenomenal in his work in terms of the Black LGBTQ community here in Atlanta. But he has done a phenomenal job with a documentary that'll be coming. Actually, it's a film that'll be coming out at some point in the near future. And we had a viewing of it a couple of weeks ago. It is nothing short of phenomenal. But he really goes deeper into the Paradise Garage in New York City between 1977 and 1987, and the role that the Paradise Garage actually did in terms of providing a safe space. So go ahead, Mr. Washington.
Thank you. Thank you. I'm always happy to talk about and share the impact and the multiple roles of the Paradise Garage. Can you hear me well?
Loud and clear.
Okay. So a bit about the history of the club. It was started in 1977, and the garage's lifespan is such a central part of the story and its impact, because as Larry notes here, it was open from 1977 to 1987. And that span encompasses the emergence of there are other phenomena as well, but certainly the peak of the disco era, which is really mid 70s to late 70s, before the infamous, oppressive, and homophobic, racist backlash against disco itself and disco culture. And it also spanned the emergence of the AIDS epidemic. right? So that social history is tied, as well as the expanding visibility, not just of specifically or overall LGBTQ community and culture in New York, but also specifically Black and Latino LGBTQ community. The visibility is it increases, it expands around that same time. Um, it was founded by Michael Brody, a white gay man who had the vision and wanted his own club. He had seen some of the precursor clubs that actually influenced and inspired the Garage, chiefly the Loft among them, uh, in terms of having a space where that welcomed diversity, all right, that wasn't stiff, that had music, alternative dance music that you didn't necessarily hear on the major radio stations. He also connected with Larry Levan, the principal resident DJ, and pretty much the architect. So if Michael Brody actually brings the vision and lays the foundation, Larry Levan actually makes it real. Larry was he defies description. I would say this one way of perhaps conveying his impact and his status was, I would venture that if you did a poll with, the major DJs or the internationally recognized DJs, in terms of who would be singularly one of, if not the most influential DJ, it probably would be Larry Levan. He was close friends with Frankie Knuckles, another celebrated DJ that we lost some years ago, both Black queer men. And Larry brought to the Garage such a sense of freedom and innovation in terms of the music that he played. And let me say this, there were several elements that made the Garage stand out and also facilitated it being this space that drew, again, a diversity of folks. So you had gay, straight, trans, Black, Latino, white, Asian, but certainly as this picture pretty much captures, it definitely had as its base, a largely Black and Latino, largely again gay base. It was a parking lot, a parking garage. So hence the name Paradise Garage. And they turned it into this cavernous space. They had actual live performances there. You'd have to get there. Don't try to get to a performance before 2 o'clock or 3 o'clock in the morning. And on any given night, you might see anyone from Sylvester to Lolita Holloway to Grace Jones. I saw all three of them there. Shaka Khan made an appearance, Gwen Guthrie, and other notable artists, some who, like I mentioned, that whose fame expanded or extended beyond the disco designation, and then some that were known for their dance hits. So Larry Levan exposed those artists and supported those artists, particularly Gwen Guthrie. How many of y'all remember No Romance Without Finance? Ain't nothing going on but the rent. Gwen Guthrie. Well, I see some nodding heads. So she was the queen of the Paradise Garage in that Larry invested a lot, produced her work or made remixes of her work. So there's this wellspring of creativity at the Garage. And it played the music that we love, particularly, and I'm saying specifically Black and Latino folks. So it was a white owner who, along with his partner at the point of its founding, that was his life partner. They were romantic partners, Mel Cherin. And Mel was a record exec, West End Records, and Mel helped to finance and support Michael and Larry's dream. And one of the examples of Mel's support was not only financing the founding of the garage, or helping to back the founding of the garage, but Mel offered his apartment to serve as the first headquarters for Gay Men's Health Crisis, which is one of the first. Gay Men's Health Crisis is that first generation of AIDS service organizations. So early on, the garage becomes instrumental in the fight against AIDS. Keith Haring, the renowned legendary artist who himself succumbed to AIDS, was a frequent garage goer, and actually had decorated the garage, and actually at one point did body paint for Grace Jones, and did some phenomenal work in terms of using his work as AIDS advocacy. So the legendary Silence Equals Death painting, that's excuse me, that's it. That's Haring. I started going to the garage in 1980. I missed the first 3 years. And I was a young gay man, just at the brink of certainly discovering and accepting my identity. So the garage was important to me and my friends. There were other clubs that I had certainly enjoyed at that time, the Nickel Bar, Better Days, and 96 West among them. And so I'm not in any way dismissing their importance or their brilliance. The garage was so unique, if not for the music and the phenomenal intuitive approach to music that Larry played. We, as as I'm going to say Larry, Professor Bryant was saying, I am working with Alvin Agaret on a documentary on the Paradise Garage, and we interviewed Professor Bryant, among others, to talk about the impact. And one of the things that was noted was the way that Larry played, and that Larry was so intuitive. He would play songs that sometimes he would repeat songs or break a new song, and to the point where it would move the audience. He had a way of telling a story with a song. So a lot of the songs that he played seemed to have stories to them. And he knew the crowd. He didn't play a rehearsed or pre-planned play. At least it certainly didn't come across that way. He was both following and leading the crowd. And it was such a powerful exchange between the audience and the DJ, like no other I'd ever seen. It was phenomenal. It deepened in terms of its importance to me as a young gay man when in 1985, I developed early classic symptoms of early HIV disease: swollen lymph node, thrush, the oral yeast infection, night sweats, all of that. So at that point, at that pivotal point, I was going to the garage, and it was not only a place of respite, of pleasure and dance. It was certainly a place of respite. It was a place where I can forget about that for a minute, or just get that spiritual infusion from that collective dance experience. It was yet another example, as with Catch One, of the importance of the clubs particularly during that era, right, Larry? And particularly during that era,
Absolutely.
not only in terms of fundraising and such and community awareness, but giving us a place where we can celebrate and be loved on. I'll just leave this with you. It's a telling expression that back in the day, when gay men and other folks of the Alphabet City community, when they would talk about having a good time at a club, Daryl, as a matter of fact, one of my brothers who also succumbed to AIDS, would say, we had church. We had church up in there because I think the garage and other clubs also served as a place of spiritual nourishment and affirmation. It certainly is, as a lesson of history, it also challenges us. How do we continue to build affirming spaces for our community as a way of addressing HIV and AIDS in 2024?
Thank you. Thank you so much, Craig. And again, thank you for your phenomenal work. And just one last caveat before we call my other colleague, Reverend Cedric Gardner. Craig was also very instrumental in setting up Second Sunday here in Atlanta, where we came together as Black gay men and LGBTQ to come together as community and talk about issues and begin to be able to resolve problems. So thank you for facilitating that and just being another hero as we celebrate Pride. We want to celebrate our heroes as well. But before we go to Philadelphia, I want to go here to Atlanta because my colleague, Reverend Cedric Gardner, he's got to leave soon, but I wanted to bring him in because he's been instrumental in really pioneering and bringing together the faith community in HIV/AIDS ministries and services, and I was a part of that as well early on. So, Cedric Gardner, if you're still on, come on down.
I am on. It's good to be here. Blessings, Larry, and everyone.
Absolutely.
So just, we hear about LA and New York, and you talked a little bit about Philadelphia. And of course, in Atlanta, we're in the South, so it's a little different. And I came into this work, I was working on my master's of public health degree at Emory School of Medicine, and there was a panel of people talking about HIV in the community, and there was a Black heterosexual woman who was basically started an AIDS service organization out the trunk of her car. And she talked about how being gay in the Black community was like the elephant in the living room. And she gave all these anecdotes, and I thought, she's right. People may know, but nobody talks about it. And I realized that people didn't have the skills to talk about it. So I ended up being the first director of volunteers for AIDS Atlanta. Needless to say, I had 500 volunteers, over 500 um, volunteers at AIDS Atlanta, and probably 10% of them were African American. I ended up going to work at Outreach Incorporated, where they dealt specifically with people in recovery and dealing with HIV disease. And I guess that's where I met the bulk of the LGBTQ community who was working on this epidemic. And it was really interesting. There were things that were going on. I'm sure you and Craig remember Henri McTerry, who would have these Labor Day parties in Atlanta. There'd be hundreds of Black gay men all around the country coming for his Labor Day parties. That's one of the reasons why Atlanta became a mecca of Black gay folk for Labor Day weekend. Um, and one of the things I realized, I did a Project Aries focus training for people living with HIV disease. And I just want to tell the story of a few people who were in that group, because this support group, which was supposed to be 6 weeks ended up being 4 years every week because there was such a need. But there were three people I want to talk about in that group who I assumed were straight men because I had no other indication. One was married and in the military when he came in the group. One was married and raising two kids. One worked at the health department and was not married but was dating women. And in the course of me being in this group with these men over the 4 years, the man who was in the military, who was married, I just knew that he was heterosexual, at least with women. And he said, we're just married for convenience. I needed health insurance. She needed a dependent. We were both in the military, and so that's why we got married. We share separate bedrooms, but in the case of the outside world, we are a couple. And I thought, I didn't know people lived like that. The person who was married raising kids, he and his wife went to the same college, Savannah State, and her best friend in college was gay. He ended up, they were together that whole while. She married him somehow. And then she found out after the kids were like 10 and 8 that he was full blown AIDS. And somehow she seemed shocked. And I thought, but she was friends with your lover for her whole life. What was the gap there? And then this guy who worked at the health department who was still uh, dating women who I thought, well, he's a straight man. And he said one day to me, Cedric, my penis has never touched a pussy. Excuse my language. My tongue has never touched one, nor has my finger ever touched one. And I thought, well, then you're not heterosexual. But he was still um, dating women for cover. And I just want to say that in the South, it was more like that people who may have been in the LGBTQ community were not able to be as out as some other cities like Philadelphia, New York, um, LA. But needless to say, the activities were still going on, which is probably why the epidemic had such high numbers in the South, and may be part of the reason why still in the numbers are so high in the South now. Just because there are certain things that good, polite Southern people don't talk about in public. And some of those things ends up being to our detriment. I think the pulling out the South and Atlanta being kind of the hub of the South and where all of the LGBTQ folk flock to from the South, um, we still have remnants of that in the community. So I'm very grateful for those people who early on came out and started AIDS service organizations. Sandra McDonald, who worked with recovering addicts, uh, and had them at all the health departments getting people in recovery because we know, as Larry has already mentioned, substance abuse is something that goes along with HIV disease. And if you're dealing with one, you need to deal with the other. And those people who were wise enough to meet people where they are, to walk them along a continuum for transformation. And Hillside International Truth Center, which I'm still a member, founded by Dr. Barbara King, who knew that it was important to do something. So we've had an AIDS ministry at Hillside for over 30 years. And one of the things I heard Dr. Barbara say early on, and I don't know, at this time she was like a 60-year-old woman who had been a pastor of a church for 20 years. And she said, if you have problems with gay and lesbian people being in the congregation, this is not the church for you. And I suggest that you get up and walk out now. And I thought, well, I have never heard anybody say that, and particularly this grandmother figure. But all of a sudden, I felt very comfortable in the seat. And she's just been able to do incredible work, HIV testing in the church in the 80s, in the 90s, well into the 2000s. And it took these people who were non-traditional, who could speak out and have an authority, who made a difference in our community. So I'm very grateful for them.
Thank you. Thank you so much, Reverend Gardner. And again, just the prolific work that you are doing and the work that you have done. And we both actually participated in the HIV/AIDS ministry at Hillside during that period. And it really set the stage for a lot of the work that I currently do. Philadelphia. Mr. Nate Townsend, are you on? Mr. Nate Townsend.
Hey, how are you today, Larry?
Great, great. Nate is again another one of my colleagues who is a fearless advocate in terms of HIV/AIDS, but he's also from my hometown of Philadelphia, Pennsylvania. That's the city of Patti LaBelle, Teddy Pendergrass, the OJs. So yeah, and we've known each other, oh my goodness, for over 30 years, but he just does phenomenal work in the past, but as well as working with NASM now, and is doing some phenomenal work. So if you could briefly, for about 5 minutes or so, Nate, talk a little bit about your experience in Philadelphia and what you're doing now.
Hello, everyone. I really thank everyone for being here. I think that it is a remarkable webinar thus far, but also very emotional and very moving. And I would imagine it would be for all of us for different reasons. I was diagnosed in 1984. So it's been about 40 years. October will be the year will mark that date. And back then, everyone did assume that it was a white gay disease. And when I went to go get tested, it really was more symbolic than anything because I had never had any kind of sexual interactions with anyone from the Caucasian race. And so I guess right there, that was the first thing when they told me that I was positive, that right there told us that it was not a white gay man's disease. With that being said, what we started seeing in Philadelphia was there was a lack of support, a lack of information, much like the confusing information associated with COVID. And there was no Black response. In fact, it took, I think it was Jane Shaw, who was a nun and started Philadelphia Fight, but they created a hospice out of a church in order to help people transition. Funeral homes would not embalm individuals. Churches would not do their services because people did not know what their risk factors were. I think the most horrific part of it for me was seeing people disappear. Craig, a good friend of mine, alluded to the clubs as being a church. And I saw some of the grimaces on faces as he would allude to a club as being a sanctuary. But when you think of the fact that you're not welcome anywhere else, and that this is the only community space that you might have where you can gather, saying it was our church is basically what you would call now a drop-in center. So that was where we would see people. So like Larry, Larry would see me at our clubs. And what would happen, it was almost from a religious perspective, you understand the term caught up in the rapture. It would be like we would go to the clubs and this person would be missing. Next week, someone else would be missing. And you would see this happen quite frequently. And the assumption was that they were either dead or they were gone and they were dying. We had people who were very significant in society who would actually go up to the mountains and just disappear because one, they didn't want their family to see them that way. Two, they were very private. And so you look at people who are at the end of their lives way too early, who don't have a physical ceremony where family and friends can memorialize them. And that was very sad to have to go to the end of your life and not have support. I remember saying that if I ever got to that point, and many people said if they ever got to the end stage, that they would commit suicide, they would go away. Fortunately for me, I did reach that stage in 2004, spent 40 days in a hospital. But for me, I wanted people around. I wanted people, close by. I didn't, and so for that was 20 years into the HIV epidemic, or for me, and I had never disclosed to my family. And because I just felt that it wasn't necessary. I had no fear of rejection or any of that. I'm fortunate, like one of the other gentlemen on the call said, that I was one of those people that my family loved me for me. We've never talked about any of my statuses, and I'm pretty sure that they knew who I was, but they loved me for me. Unfortunately, that was not the norm. People were kicked out, people were alienated, people were ostracized. Churches put people out once they found out their status. And like Larry intimated earlier, for some people, this was the first time they had to talk about their sexuality, because it wasn't like having cancer that was, totally a sexless disease, but you're telling people about something that they identified as a gay epidemic. And so now you're coming out more times. You're coming out as being an addict. You're coming out as being an alcoholic. You're coming out as being, any of those other things that affect it, because we know that HIV is a biopsychosocial disorder, meaning that it affects every aspect of that individual. When you say biologically, that's about our blood. Psychologically, it means that people had to face impending doom. People had to be crippled by stigma. People had to fear of rejection. Then there was also fear of incarceration. There were just so many intersectional layers that people had to deal with that many just gave up. I could stand here today, and even if I didn't like Larry Bryant, that man standing right there, the fact that I saw his face 2 years ago in a club here, I'm now getting emotional. It brought joy to me, because I never knew where he went. We were friends. He disappeared. And like I said, he just assumed that it would just go on. And so I hugged him that day at Mix, because I realized that he was still here. And if I talk about how many people, they were just, when you think about, my grandmother said this one day, she had 22 grandkids, and she told me that she was lonely. I said, Mama Rosie, how can you be lonely and you got all of us? And she said, because none of my peers are here. None of my contemporaries are here. I didn't realize that until all of my aunts and uncles are gone. My mother gone. And you just feel that all of your support systems just dissipate. But every lover that I've had is gone. And then you sit here and you say, why am I still here? HIV and aging is a phenomenon they talk about now, but who the only people that's about me and Larry. There's no others before us that are still here. And so there's no preparation socially, no preparation medically. Doctors still don't know what's going to happen with us, because there were none of us. We're the first generation of people that with HIV that have lived this long. I sold my life insurance, $300,000 of life insurance in 1999, because they said I had 2 years to live. Imagine that. People ask me, what did I do with it? I said, what the hell would you do if you died? I bought everything I wanted, went everywhere I wanted to go. And all of that was just superficial and temporary. But guess what? I had the time of my life until I didn't die. You look back and you say, well, I could have done this, I could have done that, but that was not the state of the affairs. What that told me, which is a lasting memory for me, is that the good news is that the bad news is wrong. Only God knows what the plans are. Man can only guess, but he knows best. That's what I got.
Thank you so very, very much, Nate. And again, I could feel your emotion, and it took me back to that period in the early 80s as a respiratory therapist, knowing so many people that came into my hospital at that time who died alone. And that just was, and all I could do was just hold their hand. And that's got to be one of the worst feelings, to just like nobody's there for you. Oftentimes, the families would not allow friends to visit them at the hospital. And, although they would kick their kids out, once the child died, oftentimes they were the first ones to make sure that they got all of the assets. And so that's why really doing a will, that's why really making sure that your belongings go to who you want them to go to is so very, very important. So Nate, thank you so very much for that. This video will be made available to you. Had another video here, but just for the sake of time, because I want to hear from some of you in terms of what you have gone through as well. And so I know just briefly, I believe it was Robin Hill had her hand raised. Can you come off of mute and just talk a little bit about your experience?
Well, I'm a mental health therapist, and I'm working currently on my doctorate degree in traumatology. And I was just wondering, because I'm hearing slight nuances that kind of remind me of how the pandemic was handled. And I was wondering, is there any research or conversations being had as far as how the pandemic affected you all? Because it sounds like it was a reminder, or it could have been a reminder. And if it, this is a traumatologist in me, was there any emotional, remembrances, or how did how did the pandemic affect you? Because I would think that living through that time, and then having to almost re-experience it again with reminders during the pandemic of the unknown and people being here and being gone the next day, that would have been a hard time.
Well, that's certainly a great question. And there are a lot of similarities between the corona pandemic and HIV/AIDS. First of all, to one thing about the pandemic was that many, many, many people had to die alone. Many people had to die alone in nursing homes, in our hospitals, because families could not visit. So that was a similarity, just in terms of those that leaving here without not necessarily without the support, but without having your family there with you. That's got to be just the most devastating thing. But of course, in the pandemic, we know many, many people, that was the reality for them. Also, again, back in the 80s and to a certain extent the 90s, the same thing happened. I was there, because I've been a respiratory therapist for 50 years now. And in almost all of the hospitals that I worked at, not just in LA, but in Philadelphia as well, I've seen this story over and over again of people dying alone. The other thing is that the HIV's epidemic helped us to inform infectious disease in terms of how we dealt with a disease that was contagious, particularly more so with COVID, because it was airborne. And that was the scariest thing in the world. But again, universal precautions, needleless syringes, those kinds of things happened as a result of the HIV/AIDS epidemic. And so we were able to carry much of the learning scientifically from the HIV/AIDS epidemic into the COVID epidemic as well. And I think, Craig, you had something that you wanted to say?
Sure, sure. First of all, I want to thank Ms. Robin. That's a gorgeous question. It just is, particularly for this discussion, right? I think that there was and I really appreciated, Larry, how you asserted that piece about how much, God, how much we benefited, how much we learned from the response to AIDS, because years, decades after those most severe years of the epidemic, we're still benefiting from the tools that we forged during that time. I will say, though, I did note that just like with some of the diseases or epidemics or um, health conditions that landed before and after AIDS, there was a distinction. And what I mean by that is that, it's just, I'll say the obvious. The early response or non-response was due to not AIDS stigma. AIDS stigma is really just a distillation of racism, misogyny, homophobia. And so those of us, whether it was those first 5 cases of white gay men or the black and brown gay um, hetero women, cisgender, transgender, we were considered disposable. Certainly the gay men, you know, even within Black community. I don't know how many of y'all either know of or remember, but I think this is it's the most glaring example. Eddie Murphy had an album that was based on a live performance, and one of the cuts, I believe the track was, it was on a vinyl. This is like 80, 83, maybe 4, was, I think it was either called Faggots or AIDS, one of the two. And he talked about how he was scared because as a straight man, now he could get it because his girlfriend kept kissing on her gay friends. And so when they would hang out and they would kiss, if he would kiss his girlfriend, he might catch AIDS. And people laughed. And I remember hearing that laughter and how that cut, because that's my people. That's my brother, Eddie Murphy, right? And my people seeing the impact of this devastating disease as a punchline. And so the mobilization around COVID, while it was flawed, and it had its own implications, right, around racial disparities, we saw that too. The negligence and the fumbling, particularly under former President Trump, was nowhere near the negligence, the abject negligence and refusal, because in 1982, throughout half of his second term, President Reagan never said the word AIDS publicly. So there's some starkness there as well. I think that, again, if anything, we were somewhat prepared, and I'm grateful for that. And I think as a people, particularly as Black people, what's the old adage? When America catches a cold, Black people get the flu. So we saw that again replicated with COVID, right? So if anything, what are the lessons we learned and how we inspired to continue to not forget the impact of poverty and structural disparities so that the next time we're better prepared, better equipped. We have to have a social justice component always embedded in our public health efforts.
Thank you so very, very much for that, and thank you, Michelle, for the question. And the other thing, just in the last couple of slides, want to talk a little bit about what's going on now and looking at the data. How do we get to this? How do we get to this data that we're seeing now? And what it's saying is, if current HIV diagnosis rates persist, and you heard some of those, some of that data, the CDC, this is the CDC, says that 1 in 2 Black men who have sex with men, they use that term, will be diagnosed with HIV during their lifetime. How do we get from those 5 white gay men to the epicenter of this epidemic, and it's still a raging epidemic, gives us data such that 1 in 2 Black MSM will be diagnosed, and 1 in 4 Latino, compared to 1 in 11 whites. However, there's a game changer now. In 1996, the development of antiretroviral therapy, and what I want to say with this, things are so different now. But if you don't know your status and you're not tested, you will not be able to benefit from these life-saving drugs that are out there now. And so in terms of ATR, we call it an antiretroviral therapy, it provides a level of what we call undetectable. That means the virus becomes so low in your system that you cannot pass the virus on. So undetectable equals, here it is, undetectable equals prevention. And so this is a game changer in terms of prevention, but we've got to make sure that it gets and reaches the right community. And also pre-exposure prophylaxis is a prevention, and this was adopted in 2012, and this really helps to prevent individuals who are HIV negative from actually catching the disease. And so we got about 7 minutes left. And before this is the last slide, but before I go to this slide and really talk about just the remarkable, the prolific work that's being done here in Atlanta. It's being done all over the country, but I kind of focused here on Atlanta because, recently that's what I know best. But if we could put the link into the chat room for the Center of Excellence on LGBTQ plus health equity, who does phenomenal work, and I consult with them on a lot of different topics related to LGBTQ in the Black community. But they're having a series of podcasts that are coming up, and that link will send you right to be able to register for that. So if we can put that link into the chat room, that would be phenomenal. But again, just these organizations here, we've got NASM, who does phenomenal work here in Atlanta, and Nate also works for NASM. And so again, phenomenal work. Here's to Life does a wonderful job in terms of providing services for LGBTQ plus, as well as others in our community. AIDS Education Training Center, along with Ms. Kanisa Washington. I do so much work for them in terms of consulting, but they really, really do a phenomenal job just in terms of providing education around HIV/AIDS, particularly in the African American community. And of course, my baby, my dear, the African American Behavioral Health Center of Excellence. I just cannot say enough about the work that Dr. Dawn Tyus, Corey, and the rest of you, Pamela Lee, are all doing here in Atlanta in that area. Also, Someone Cares has done a remarkable job, and Ronnie has been the visionary in that organization that just provides so many services, particularly focused a lot on the trans community. And of course, Anise Incorporation, who the CEO, Zena Age, does a wonderful, wonderful job in terms of providing services for our community as well. And finally, Thrive. My friend Larry, who's the CEO of that organization, does phenomenal work as well. So these are the community assets that we have. And so we've got just a little more than 5 minutes left. And just wanted to know if anyone wanted to, in the last few minutes, just like come off and maybe talk about some of the historical kinds of things that maybe is happening or happened in your state that you might briefly want to share with us. Anyone?
I'm Dr. Stephanie Abernathy Lane.
Yes.
And
oh
I
my
am
God,
a student.
Stephanie. Oh, thank you, thank you, thank you, thank you. Yes,
Dr. Lawrence
Stephanie
was
is just so phenomenal. I also direct dissertations at Capella University, and Stephanie's going to talk a little bit about the prolific study that she did, and I helped facilitate her study, but it was nothing short of phenomenal. Go ahead.
Okay, and the topic of my dissertation is long-term survival strategies for same-gender loving African American males living with HIV. I'm upon, I guess, going or getting ready to, just bear with me, I'm a little nervous, starting my dissertation, I said, well, you know what? How am I going to get my participants? So I said, well, it's time for me to insert myself, surround myself with the LGBTQIA community. And that's what I did. I was accepted. It was awesome. I attended as well as helped prepare for events. It was just certainly awesome. I went to focus groups. I was able to gain or able to garner my participants, and they were wonderful. And during my dissertation, they were candid. They spoke with me about what was going on in their lives, because my dissertation started with the age of 45 to 70 plus. And with that, I was able to go back to where it was really highly prevalent when it came on the scene and talk with these older gentlemen. And I'm telling you, it was great. It was phenomenal. I'm still keep in touch with some of them. And what it did, I'm going to go from there to now. What it did, and plus I was working with the aging. So what it did, it inspired me. Well, everybody gets old, everybody age. And now with HIV/AIDS, you're aging, but you're aging and you're living longer. So let me bring that into my group. So I started a business, and it's called Living an Independent Lifestyle. So I said, with this, well, let me put another topic to it, and it's on my website, and it's HIV/AIDS while aging. And I came up with a new way of reimagining aging, and it's starting with the ABCs. Aging, a beautiful continuum. So from there, I just started to reimagine what it could look like, because we're getting older, we're living longer. Make it the best life we can have. And part of that came about because of my dad, and we were talking about COVID-19. My father passed away during that era, or not era, a couple of years ago. My father passed away. And I'm like, I had to take him in because his wife had suddenly passed. So I had to take him in. And my father had mild dementia. So I worked with him, and I would go back and forth with the nurse practitioner, with the hospital. They said, well, you know what? He has mild dementia. He's a fall risk. And I had hard wooden floors. And my father, a lot of times when they're old, they want to go back. I got to go back home. And my father would try to leave, but of course the alarm would go off in the home. But he still was a fall risk. So my father, he had a little assets. So I said, I'm putting him in the best place I can put him. And I did. When I put him there, he developed COVID-19. They were calling me because I was in touch all the time. Well, he failed twice a week. I said, I said, there's something wrong.
Mm-hmm.
Come to find out, he had COVID-19. They put him in the hospital. I was so hurt because I had started taking care of him. I was so hurt. I'd get up in the morning with him. He'd fix him breakfast, because I was able to work from home. Mm-hmm. Fix him lunch, dinner. And I said, I'm not going to let him die alone. So I said, when they put me in, he went from 10 liters to 15. And that's what was keeping him alive.
Okay.
So I said, you know what? He's going to see me. So I said, you better prep me the best way you can. And I went in there and I talked with him, because they said, well, when we take him off this oxygen, he's gone. I said, well, he got to hear me. He got to listen. He got to know somebody's there for him. Now, this is getting emotional for me. And I was there, and I sat in his room. I talked with him like Nothing ever happened. I talked to him like everything was okay. My siblings, they doing well. I'm telling him this and all that, and I can hear he's trying to talk to me. He's trying to talk to me. But I knew he knew someone was there with him. And that night, I'm just going to tell you, I don't know, it was just my imagination or what. I felt his presence walk through my room.
Absolutely. And so thank you so very, very much, Stephanie, for that. And just the phenomenal work. And as I'm just saying before everyone, we need to publish because your work is just phenomenal.
I know. And I want you to know this too. And on my site, and I said, I'm going to incorporate HIV, AIDS, and I did, as a beautiful continuum because we're living longer.
Absolutely.
So I plan on opening up a commercial space, and I'm bringing focus groups, and I just want you to know about that.
Thank you so very much. And we're at the hour, 1 minute past, but I think emotional for many of us. And so I want to thank you all for participating in this. I want to say this is part 1, and hopefully we'll do the part 2. Thank you for our guests, Mr. Washington, Mr. Townsend, Mr. Gardner. Thank you so very much. And thank you all who participated. And I guess I'll turn it back over to our host.
Yes, thank you, Dr. Brian, and to every guest, every speaker. Thank you for sharing vulnerability, honesty. What an amazing webinar today.